Hi everyone, my name is Katie Lane and I'm with Truven Health Analytics. Truven Health is the education, training, and assistance contractor for the MACPro system. The purpose of today's webinar is to help you understand the roles and the responsibilities of the roles in MACPro's Health Home State Plan Amendment submission process. Additionally, by the end of this presentation, you will understand the next steps for getting ready to work on health home spas in MACPro. I'm going to be placing the call in presentation mode now to prevent background noises.
Presentation mode is now enabled.
And there will be an opportunity to ask questions at the end of this presentation. CMS and training personnel are here to assist with any questions you may have at that time. Also, please note that we are recording this session for future viewing. They will be placed on Medicaid.gov at a future date, and the slides presented today were provided via email. Additionally, if you'll notice in the chat box, I know we'll be talking through a lot of things. We will have an opportunity for questions at the end. As you think of questions, you can feel free to shoot them to the participant named Ask Me a Question. So now we're going to dive in. We have a full agenda today. We'll start with a brief background on MACPro. Then we will discuss the rollout plan for MACPro Health Home State Plan Amendments, or SPAs, followed by details on the conversion from MMDL, or the Medicaid Model Data Lab, to MACPro, and an explanation of the MACPro Health Home SPA user roles and the workflows in which they are involved. The webinar will end with information about how to access MACPro, next steps, how to obtain technical assistance for using the system, and an opportunity to ask questions. So let's begin our webinar with a brief background on MACPro. MACPro is a web-based system for the submission, review, and management of Medicaid and CHIP initiatives such as state plan amendments and quality measurement reporting. For some applications, MACPro will be a new online submission tool. For others, it will be a change from what was a manual workflow to an electronic workflow. And for some, it will be the first time information is collected. In terms of Health Home State Plan amendments, MACPro will eventually replace the Medicaid Model Data Lab, or MMDL, and the paper-based process of submitting and reviewing health home SPAs. MACPro is being implemented to improve the state reporting and federal review processes, program management, and transparency. Both CMS and states will know where a submission resides, when the CMS response is due, and the status of the review. Additionally, MACPro supports data-driven decision-making for Medicaid and CHIP programs. So let's talk about the Health Home SPA rollout plan. If you are involved with quality measures reporting, you may be familiar with MACPro already. It was launched in December of 2015 and contains the quality measure reporting for the Maternal Infant Health Initiative, Health Homes Quality Measures, Adult Quality Measures, and Child Quality Measures. Today's training will focus on the available roles in MACPro for Health Home SPA users. Future trainings will be offered on how to submit state plan amendments and CMS's review and approval processes. Health home SPAs previously approved in the Medicaid Model Data Lab will be converted into MACPro. The data in MMDL from approved health home SPAs will be copied into the MACPro Health Homes template for states to use as the basis for future amendments. States will find the MACPro screens pre-populated with the currently approved information, except where the MMDL and MACPro templates differ. Additionally, the official and complete copy of all health home SPAs approved in MMDL may be viewed in MACPro as PDFs. Health home SPAs currently being processed in MMDL will be completed in MMDL. And once the MACPro Health Homes application is operational, CMS will announce a date by which the last submissions can be made in MMDL. Finally, when subsequent SPAs are submitted and approved in MACPro, they become the official record of the Health Home program. Let's now review the state workflow for official submissions. In this section, we will cover generally who is involved when a state creates and submits a SPA. This page lists MACPro's Health Home SPA state user roles. A state user may have more than one role in MACPro, with one exception. The state system administrator can only hold the state system administrator role. It is important to note that all state roles must be filled for proper workflow functionality. Let's go over the 4 state roles in detail. The state editor begins the state report process in MACPro and is responsible for creating state plan amendments submission packages. State editors can simultaneously hold the roles of state point of contact and state director. The state point of contact, or SPOC, is the next person in the process. The SPOC role is responsible for reviewing and submitting the SPA submissions to CMS, responds to requests for additional information, which are RAIs, from CMS, and documents and reviews the correspondence log. SPOCs can also hold the roles of state editor and state director. The state director is the third step in the state SPA submission process. The state director role reviews and certifies submission packages. State directors can also hold the roles of state editor and state point of contact. The State System Administrator, or SSA, is an administrative role that can create and maintain the state profile, which must be completed before any SPAs are created within the state. The state profile is something that we will go into in further detail in our in-system trainings, which are going to be next week. Additionally, the State System Administrator can approve state roles requests for users. Please note that this will not be the case for the initial rollout of the Health Home SPAs. They also can reassign state tasks and disassociate users from roles. SSAs can only hold the State System Administrator role, and the role must be filled in order for the state users to request their roles. Next, we will review the state submission process flow. In this section, we will cover generally how a state creates and submits a SPA and who from the state is involved in the process. Here is the full state SPA submission workflow. Let's walk through the steps for this process. First, the state editor creates the SPA submission package and completes and validates the reviewable units. For your reference, reviewable units are essentially sections of the state plan amendments, such as Health Home's payment methodologies. These sections are currently all within one page within the MMDL, and we'll look into what reviewable units are in a little bit more detail, again, in the in-system demonstrations. Then the state editor sends the package to the state point of contact, or SPOC, for review. The state point of contact reviews the package and includes any needed updates. The state point of contact may return the package to the state editor for further edits if needed, but if not, the state point of contact forwards this to the state director for review and certification. The state director then reviews the package, but they cannot edit the information. If edits are needed, the state director may return the package to the state point of contact. Assuming the state director certifies the package, it is sent to the state point of contact for submission to CMS. The state point of contact then can submit the package. However, if they notice changes are needed, they may select to edit the package and resend it for certification by the state director. There will be a state-focused in-system demonstration that will review each of these steps in further detail. Again, this will be held next week. So let's now review how you obtain access to MACPro. First, your team will need to determine what your primary and secondary MACPro roles will be for health home spas. Remember, roles need to be filled for proper workflow functionality. Then, coordinate with your team to complete the MACPro roles template. All invitees and attendees will receive the MACPro roles templates following this meeting. Once your roles template is filled out, a representative from your team will send one roles template with all information to the MACPro Help Desk by March 23, 2016. Users should select roles that can be held concurrently. There are certain MACPro roles that cannot be held with others. Specifically, the state system administrator cannot be held with another role. As we mentioned previously, certain roles are responsible for approving other roles. This hierarchy indicates which roles are approved by whom, and as you can see, the state system administrator approves all state roles. For the initial rollout of the Health Home Spa Authority, this approval hierarchy will not be used as MACPro roles will be assigned to accounts manually. However, keep this in mind for the future when user management functionality is released. So technical assistance will be available to all MACPro users. For issues related to MACPro access and how to use the MACPro system, contact the MACPro Help Desk at MACPro_helpdesk@cms.hhs.gov or call 301-547-4688. To help expedite an answer to your request, here's the information that should be provided in an email request to the help desk. Be sure to include your contact information, the application you are using, so in this case you might want to indicate that you're using MACPro for health home spas. Give a detailed description of the problem, and if applicable, include how many people are being affected by it. Specify the last screen or activity that was performed before experiencing the issue. And if there's an error message, please include a screenshot that is preferable for assisting you with your issue. So here's a reminder of your next steps. Invitees and attendees will receive the MACPro roles template from the MACPro Help Desk to indicate the names of the persons fulfilling each role needed for the state review process. Once the template is filled out, it should be sent to the MACPro Help Desk for processing. This email again is MACPro_helpdesk@cms.hhs.gov. There will be an in-system training demonstration that will walk through the workflow we reviewed today, and you will receive notifications with your MACPro information. And finally, look out for the MACPro Health Home State Plan Amendment release announcement. So now I'm going to open up the lines to see if there are any questions.